Good day, everyone. My name is Nathaniel Pilapil, and my topic is all about COVID-19. Introduction. The COVID-19 pandemic, an unprecedented global health crisis, had an far-reaching impact across all sectors of society. Originating in Wuhan, China in December 2019, the novel coronavirus SARS-CoV-2 quickly spread worldwide, leading to widespread illness, death, and disruption. By March 2020, the World Health Organization declared COVID-19 a global pandemic, a designation that underscored the severity and rapid transmission of the virus. Vulnerable population for COVID-19 include elderly individuals, individuals with chronic condition, immunocompromised individuals, pregnant individuals, and people with low-income communities. As of 2024, COVID-19 continues to be monitored globally with ongoing case reports and vaccination efforts. Many countries have shifted to managing it as an endemic virus, focusing on booster shots and variant surveillance, while severe cases have declined significantly due to vaccination and natural immunity. Occasional outbreaks still occur, especially with emerging variants. Public health measures remain important, particularly in vulnerable population. So now let's proceed to the pathophysiology of COVID-19. Risk factor is increasingly is the senior citizens and presence of comorbidities such as cardiovascular diseases, chronic respiratory disorder, diabetes mellitus, and cancer. However, new research found that also younger people can be infected with COVID-19 virus. So first is the respiratory droplet production from a person such as cough, sneeze, or talk, especially if he or she is infected with the virus. There will be droplet contact to the mucous membrane and adherence to formites such as doorknobs, surfaces, and clothing. So those mechanisms will lead to exposure with a person that has SARS-CoV-2 or severe acute respiratory syndrome coronavirus. And that will lead to the attachment to ACE2 receptors on body cells. And there will be access to the body, then the virus starts to replicate, and that would cause a COVID-19 infection. But first, there will be an incubation period, initial infection to the onset of symptoms, 4 to 5 days up to 14 days. Then there will be a COVID-19 infection. So furthermore, there will be destruction of cells in the lungs, alveoli, vasculature, kidneys, heart, and gastrointestinal tract that will lead to the nasal obstruction, to loss of olfactory receptor neurons, or the anosmia or loss of smell. And also that will lead to the damage to the gustatory receptors in our tongue that will lead to the ageusia or loss of taste. So, due to the presence of infection, neutrophils migrate to the lungs that will lead to fluid accumulation in interstitium and alveoli, so which is responsible for ground glass opacities in lungs CT scan and infiltration in chest X-ray. And also there will be a dyspnea or shortness of breath. Then it will lead to the cytokine storm or increased release of cytokines. That will lead to the increase in skeletal muscle cell damage that will lead to myalgia or muscle pain. And also there will be and it will lead to prostaglandin release from hypothalamus that will lead to increase of temperature or fever. Then that will be the pathophysiology of COVID-19. So now let's proceed to the predisposing factors and precipitating factors. So first in predisposing factors is age. So older adults are at high risk for severe illness because older adults are more prone to COVID-19 because their immune system weakened with age, making it harder for the bodies to fight off infection. They are also more likely to have underlying health conditions. Second is the chronic health conditions. So conditions like diabetes, heart disease, and obesity increase vulnerability. So chronic health conditions weaken the body's immune system and vital organs, making it harder to fight infections like COVID-19. Third is the immunocompromised state. Individuals with weak immune system due to disease or medication are more susceptible. And last is the socioeconomic status. So limited access to healthcare and resources can increase the risk. So that is why socioeconomic status can increase the risk of COVID-19 due to factors like crowded living conditions and limited access to healthcare. So now let's proceed to precipitating factors. So first is exposure to infected individuals. Close contact with someone who has COVID-19 can trigger the infection, because exposure to an infected individual increases the risk of contracting COVID-19 because the virus spreads through respiratory droplets, making close contact a direct way to catch the infection. Second is in living crowded conditions. Overcrowded settings facilitate virus spread. And third is poor ventilation. Inadequate airflow increases the likelihood of airborne transmission. And last is lack of preventive measures. Not wearing masks or practicing social distancing can precipitate the outbreaks. And also not practicing hand hygiene increases the risk of COVID-19 because it allows the virus to spread more easily from person to person. So now let's proceed to the signs and symptoms of COVID-19. So the signs and symptoms of COVID-19 can vary widely, ranging from mild to severe. So common symptoms include: first is fever or chills, cough, shortness of breath or difficulty of breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, and last is diarrhea. So symptoms typically appear 2 to 14 days after exposure to the virus. Some individuals may remain asymptomatic while others may develop severe respiratory distress or complications, especially to those vulnerable population. So now let's proceed to the clinical signs and symptoms. So the difference between signs and symptoms and clinical signs and symptoms. So signs and symptoms are used to describe what you can see or feel when someone is sick, while clinical signs and symptoms are the same, but they are specifically observed or measured by a doctor or a nurse during a medical checkup. So they are part of a professional diagnosis in a healthcare setting. First, in clinical signs and symptoms is respiratory symptoms such as cough, shortness of breath, and difficulty of breathing. Second is systemic symptoms such as fever, chills, fatigue, and body aches. And third is gastrointestinal symptoms such as nausea, vomiting, and diarrhea. Fourth is neurological symptoms such as headache and confusion in severe cases. And last is olfactory and gustatory symptoms such as new loss of taste or smell. Severe cases may present with acute respiratory distress syndromes, hypoxia, and multi-organ dysfunction, necessitating immediate medical attention. So now let's proceed to the diagnosis. The primary methods for diagnosing COVID-19 are laboratory tests that detect the presence of SARS-CoV-2 virus or antibodies produced in response to the infection. So first is viral tests, the molecular test. These tests, such as polymerase chain reaction, detect the genetic material of the virus. They are highly accurate and considered the gold standard for COVID-19. So this test, it works by taking a sample from your nose or throat using a swab. So next is the antigen test. These tests detect the proteins of the virus. They are rapid and can provide results in minutes, but they may be less sensitive than molecular tests, especially in the early stage of infection. So next is the antibody test. Antibody tests detect antibodies that body produce in response to the virus. These tests can help determine if a person has had past infection, but they cannot diagnose a current infection. So this works by taking a blood sample and testing it for a specific proteins that your immune system creates after being exposed to the virus. This test doesn't detect active infection but helps to determine if someone had COVID-19 in the past. It can only take 1 to 3 weeks after infection for antibodies to appear. So when to get tested? So if you have symptoms of COVID-19 such as fever, cough, shortness of breath, fatigue, muscle aches, headache, loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting or diarrhea. And also if you have been in close with contact someone who has tested positive for COVID-19. And also if you have been advised to get tested by a healthcare provider. So now in prevention and community management, first is public health education, in awareness campaigns informing the community about symptoms, transmission, and prevention methods, and also promoting vaccination, so encouraging a vaccination through educational materials and access to vaccination sites. So second in community management is testing and diagnosis, access to testing, so providing community testing sites to facilitate early diagnosis, and also symptom monitoring, encouraging individuals to monitor symptoms and seek testing when necessary. Third is isolation and quarantine protocols, guidelines for isolation, so educating individuals on when to isolate if they test positive, and also support for isolated individuals such as offering resources like food, delivery, and mental health support. Fourth is medication for mild cases, symptomatic treatment, advising the use of over-the-counter medications such as acetaminophen for fever and pain relief, and also antivirals. In some cases, antiviral medication like oral antivirals such as Paxlovid may be prescribed for eligible individuals with mild to moderate symptoms who are at high risk for severe disease. So now is prevention in hospital management. So first is patient admission and assessment. So initial evaluation, assessing symptoms, vital signs, and medical history to determine the severity of the disease. And next is classification, so categorizing the patient as mild, moderate, or severe based on clinical criteria. So now in medication for treatment, so antiviral therapy. So example for that is remdesivir, administered for patient with moderate to severe illness to reduce the viral replication. So third is oxygen therapy. So supplemental oxygen, administering oxygen to maintain adequate oxygen saturation using methods like nasal cannula or high flow oxygen. So supplemental oxygen is important for COVID-19 patients because the virus can cause lung inflammation and damage, leading to reduced oxygen levels in the blood. This can result in difficulty of breathing and inadequate oxygen supply to vital organs. Providing supplemental oxygen helps to ensure that the body receives enough oxygen to function properly and can prevent serious complications. And next is non-invasive ventilation, so using CPAP or BPAP for patient with respiratory distress. And fourth is infection control measures, so PPE for healthcare workers, implementing strict protocols to prevent virus transmission within the hospital, and also isolation protocols, ensuring appropriate isolation of COVID-19 patients to protect other patients and also the staffs. So now let's proceed to the types of COVID-19 vaccines. So COVID-19 vaccines are essential tools in the fight against the COVID-19 pandemic. They work by training the immune system to recognize and combat the virus that causes COVID-19, helping to prevent severe illness, hospitalization, and death. Various vaccines have been developed and authorized for emergency use worldwide, demonstrating safety and efficacy in the clinical trials. Widespread vaccination is crucial for achieving herd immunity, reducing virus transmission, and returning to normal social and economic activities. So the first type of COVID-19 vaccine is mRNA vaccines. So the example of this is Pfizer, BioNTech, and also the Moderna. And the mechanism of this is use messenger RNA to instruct cells to produce a protein that triggers an immune response. And the efficacy is highly effective in preventing severe disease and hospitalization. So the second type of vaccine is viral vector vaccines. So example for this is Johnson and Johnson or the J&J, and also the AstraZeneca. So the mechanism of this is use a harmless virus to deliver genetic material that codes for SARS-CoV-2 protein, stimulating an immune response. And the efficacy for this is effective, though slightly lower than mRNA vaccines, offers a good protection against severe illness. And next is the third type of vaccine is inactive or live attenuated vaccines. Example for this is Sinopharm and the Sinovac. So the mechanism of this is use killed or weakened forms of virus to stimulate an immune response. And the efficacy is generally lower than mRNA and viral vector vaccine, but still effective and preventing severe disease. And that would be all. Thank you.